Hello, welcome to the Health In Show, an affiliate program of Homeopathy World Community. You've come to the right place to tune in and participate with your comments and questions. Love is the greatest healer of all, but sometimes, in order to change our emotions, we must take action in other spheres of our lives. We speak with experts in alternative and complementary health fields and hope you will benefit in some small or great way. Remember, you are wherever your thoughts are. Make sure your thoughts are where you want to be. Welcome to the Health In Show, an affiliate program of Homeopathy World Community. Today is April 13th, 2015. We're going to introduce our guest in just a moment. I know everybody has been waiting to find out more about autism and homeopathy. I've received numerous emails and messages on Facebook and elsewhere. They want to know where to go to see this show. It's on nissancommunications.com with our producer, Amnon Nissan. And also, this is an unusual time for us to have our show. Usually it is Monday at about 10 or 11 in the morning, and we're having an evening show to accommodate streaming live from Australia. I'd also like to begin with a prayer, a message of hope. And as I was driving into the studio, I was just thinking how there's nothing more important than our health and our children's health. And also the fact that what I believe, my faith, is beyond rational. It makes no sense a lot of the times if you try and figure out the words and the information that would substantiate how things around us in our lives and world work, whether there's coincidences or it's planned by a heavenly body, how things are. But we do know that the most important thing is our love and caring for our family members and our friends. And I want to thank everyone for so many messages of caring that I have received, and I light a candle now every day for those who are in need. I'm going to introduce Fran Sheffield, and maybe she'll add a note to that message. So we also have a PowerPoint. So do you want to put up the first slide just as the intro? Homeopathy making a difference for children and adults with ASDs. Fran Sheffield, and all of those letters, she can tell us what they mean when she gets on, because she is really highly qualified to help folks with this syndrome. And the next slide we have is introducing Fran, with qualifications in nursing and midwifery, a Master of Health Science Education, homeopathic consultant and educator for more than 20 years, and a mother with autism. And from all of the messages that I have received, she is internationally well known, and people recognize her name and have read lots of the literature that she has published and put out on the internet. And Fran, let's get you on live.
Hi Debbie, how are you?
I'm great, and I'm so happy to be with you this evening.
Yes, thank you for changing the time for me. It's made a big difference to me, better than 1 a.m. in the morning.
Yes, and as we were talking earlier, you told me that you were the first person out there doing a homeopathy radio show a decade ago, and so you were always a leader in the field.
Oh, it was just amazing. I can remember because on our first show, I was in Australia interviewing somebody in England, and it was being streamed live in the US, and that's the first time I went, wow, with what the technology can do, and it's come a long way since then too.
Okay, I know there's a big project coming up that I want to introduce to the listeners and then we'll also remind them about it later on in the show. Something that they can participate in, something that can help answer their questions, and it comes out of the kindness of your heart and your natural giving nature to help others, no matter what it costs or doesn't cost or what you reap back, but you're helping the world. So on slide number 2, it's an information sharing online book creation. So not only were you innovative with your radio show, but with this type of a publication, Homeopathy for Autism. Tell us a little bit about that.
Right. I treat a lot of children with autism and in countries right around the world, and I've been aware for some time that firstly there are so few homeopaths in the world. Increasingly that it's happening that they're treating children with autism, but especially when I first began, there were so few homeopaths providing that sort of service or understanding how they needed to be treated, and parents were having a huge problem accessing treatment. So I've always written about it and I've always spoken about it, but I'm only one person. And the other thing I became aware of, for many families, homeopathic treatment was just out of reach. Either the homeopath that they needed was too far away from them, excuse me, or the cost was just prohibitive, because when you do have a child with difficulties, the bills start to mount up with all the support services and additional treatments and just modifications even to your home you need to make. So I thought, wouldn't it be good if I could somehow communicate to people or let people know that there were some remedies that were used again and again and again for autism, that if parents themselves knew which remedies those were and what the identifying symptoms were for those remedies, that they themselves use them if they were guided in how to use them, and at least make a start in the early stages of their child's treatment to see whether homeopathy is going to be able to help or not, and then progress to a professional practitioner if they need to. Because while there are always going to be children who are going to fall into some of the more unusual remedies, the fact is 80% of them just need those remedies that we talk about as being our polycrests, or the most commonly prescribed remedies, and they do fabulous work for children. So I thought, if I can provide that information for parents, so those who can't afford at least have some way of accessing homeopathy for their child during those very important early years, or they have some understanding of the treatment that they're having with their current homeopath, and why he or she is doing what they're doing, and why their child's progressing in a certain manner. So I thought, if I could do that, it'd be a way of me passing on some of my experience, not only to other practitioners, but to parents for whom homeopathy may be out of reach.
Yeah, this is so incredible that you're doing this for everyone. I do want to make a statement, though. During the show, we're going to talk about 2 polycrest remedies, and I want folks to be aware that this information is open and public. You can find it anywhere on the internet if you're doing research, but there are hundreds of different remedies and polycrests. So it's very important that you have a professional helping you go through the case management of your child, that you don't think that you can handle it on your own or just make these selections of remedies just because you hear about it. And I just want to make that clear, that this is for educational purposes only, and we are not prescribing or diagnosing anything today.
No.
Or ever on our shows. Okay.
And these 2 remedies we're going to look at are, as you said, are only 2 of the potential remedies, but they tend to show different poles of how autism presents in children. So it'll give parents of an idea of what a homeopath's looking at and what's running through their mind, or the symptoms important to a homeopath when they're considering the case management of a child.
Wonderful. So on slide number 2, we're going to get this information out to you. She does want you to help to compose this book, which will be free online through your questions to her, and you can find it at the http://open, or regular slash, I always say back for some reason, openhomeopathy.com/introduction. And the link will be coming up live in about a week or so. Okay.
So at the moment it's redirecting just to a holding site while that particular website's being prepared, but within a week that site should be live. The other thing too, I should have given you the link, but there's a survey that we're asking parents, anybody who would like to tell me the information that would be most helpful for them in the book, if they could fill out the survey. So I'm asking a few basic questions, and those basic questions only take 1 or 2 minutes to do, but there's plenty of spaces for comments, so that if the parents or even practitioners, because amazingly a number of practitioners have responded to the survey, if they wanted to comment about their specific needs or things that they think should be in the book, there's plenty of room to write those there. And it's been a great thing to do, Debbie, because where I thought that I knew the answers that everybody wanted, or I knew the information people would want, some of the things that have been coming back in have surprised me. I thought, oh, I never would have thought to have included that, or that's a different perception to what I previously said. So it's been a really valuable thing to do.
And this is not SurveyMonkey, it's just on your website?
No, it's on SurveyMonkey, and if they go, what I'll make sure, if they go click on that link to Open Homeopathy, I'll make sure on that landing page that there's a link to the survey there, so that they'll be able to access it there.
Wonderful. Okay, I think we're ready to dive into more meaty information. And so any words that you want to use to introduce, we will go to slide number 3 about what is happening to our children.
Now, any parents with a child with an autism spectrum disorder, this sort of information won't be new to them, and it won't be new to practitioners who are treating these children as well. But it tends to be a cluster or a syndrome of symptoms, and with these children, we're getting lots of gastrointestinal disorders, immune system dysfunction, developmental problems, and psychosocial problems. And I think on the coming slides I've unpacked those a little bit as the sort of things that we're seeing in those areas.
Right, and if we had a lot of time for a lengthy discussion, we could probably go into more of what if you say gastrointestinal disorders, immune system dysfunctions, neurodevelopmental problems, psychosocial problems, how those would appear in your children, the little clues that would tip you off that something is not developmentally correct with your child. And as I was reading, I understand that the ASD is mostly diagnosed by around age 4, sometimes age 2, but maybe if you're an observant parent, you could see things really early and get a head start on it.
Increasingly, it's being diagnosed under the age of 2, and they're working on diagnostic tools that will make earlier diagnosis possible as well. But for many parents, they're aware from very early in the piece there's something not quite right with their child, and that was certainly my case. At 12 months of age, I was aware that my child was not developing the way other children were. And so then you start going off to doctors and specialists, and in the past, they used to say, let's wait and see, whereas now the focus is starting to come to, let's make the diagnosis earlier, because the quicker we can implement changes for this child, the better the outcome.
Right. And one of the things that's strange about the PowerPoint slides is I had inserted an extra slide, which seems to have disappeared somehow. Oh. It was the one, we're not answering the question how or why there is such an increase in this disease and disorder, but to take into consideration your environment, the pollution, the chemicals inside and outside of your home, the fluoride in the water, the vaccinations, dysfunctional families, shock and trauma in the news every day, and how a little infant or child could be impacted by this. And I had a question to you about this. I think people want to know the answers to this question. Basically, I'm saying, the world is still the way it is. We still have herbicides, fungicides, pesticides, all of these things going on, pollution in our drinking water, and I don't know, high power lines, and people are concerned about Wi-Fi, and you name it, it's everywhere, the GMO, glyphosate, the soil. And I say, well, it's still all out there. How will homeopathy be able to help a child or even an adult cope or rebalance?
Right. It's as you were saying, we've got all of these exposures these days to electromagnetic influences, toxins in the environment that we just didn't have 100 years ago, and we haven't been able to adapt quickly enough to cope with it. So our children are being impacted, and we're being impacted as adults as well, but with children with developing nervous systems and so on, they seem to be taking the brunt of it. So firstly, we've got to try and get those out of the environment or minimise them as much as possible. And people say, well, we can't do that, so what can homeopathy do for my child? And the way I explain it to them is that not all children react this or develop the same problems from an exposure. So one child will be exposed to mercury or electromagnetic fields and seem to have no problems from that, whereas another child will be highly sensitive to them and react strongly. And it's at that level of sensitivity, or what we would call in homeopathy susceptibility, that's where we work. So homeopathy is always about not just managing and controlling symptoms, keeping them under control but still there, but suppressed enough that we don't feel them or they don't bother us. Homeopathy is all about strengthening the body at a very, very deep level so that it can resist those things much more readily. So rather than having one child affected and the other child not, if we can restore health to the point in the child who's being affected, we're hoping to move them to a position where they can cope with those environmental stresses better than they had been, that their body's much more resilient and healthy as a result.
Yes, and you gave some examples to me of children in a family. Not everyone will be sensitive to the same things or react so drastically to the same things. And we usually give an example of people going to a community party and there's the flu going around. But does everybody get the flu? No, only the people who have a weakened immune system or are susceptible to it. So if we're able to strengthen the immune system at the deepest level using homeopathy, then we'd be able to overcome just about anything. So
exactly. And I've got an interesting story there to demonstrate how it worked, or how I saw it in my clinic as well. I treated a family where there were two non-identical twins, and with one twin, they went on to develop autism and the other twin didn't. And looking at the heavy metal load within the bodies of those two children, one twin had lots of heavy metals present. That was the twin who was affected with autism, and the other twin didn't have. Now, what the parents had done, because they'd gone down the biomedical route originally, which was, yes, try and get rid of the exposures as much as possible, and plus collate these heavy metals or use substances to try and push these heavy metals out of the body. And they were quite successful. They had both children virtually measuring at the same level of toxicity or non-toxicity. Then over a period of 12 months, the child who had been very heavily affected again started to accumulate heavy metals in the system. So something's obviously wrong at a deep level with that child. You've got two twins, same exposure, same parental influences, and yet one child is really suffering and not able to excrete or eliminate these metals, and another child is. So that's the level homeopathy works in. It comes in, and while remedies have been being used to try and detox children or move metals out, unless you actually heal at a much deeper level to those elimination systems, open up the metabolic pathways again, so the child is normally excreting the substances that are poisoning it the way a healthier child can, you're not going to, you'll just get temporary improvements. And I saw that very much in those two twins, that once both of them were prescribed for homeopathically, not only did the healthier twins' health improve, the behaviour improved, but the twin who was much sicker and starting to collect the metals again, they improved as well, and subsequently subsequent tests showed that yes, they were starting to eliminate those metals again, not because they were being pushed out artificially, but because the body was being healed at that deep level so it could eliminate those metals.
That's a beautiful story. I really appreciate it. We need to hear things like that so we understand how the body works a little bit. Let's go ahead on to slide number 4. What's happening to our children, the gastrointestinal tract disorders?
Yes, these are some of the things that you'll be seeing, or parents will be seeing, and they'll come and tell you there are food intolerances and allergies to the point of anaphylaxis. We've got a huge problem with peanut allergy here in this country. I guess you're the same over there in the US?
Yes, we have a huge peanut allergy problem, and to the point where children are not allowed to bring peanut butter and jelly to school, and they have to bring sunflower seeds, butter or something. And
Yeah.
but the latest report says that parents should begin giving their children small doses of peanuts at a very young age, and this eliminates the problem.
Yes, or they're treating them with very, very small doses. Yeah. And how homeopathic is that, especially if the child already has an allergy there, or
Okay.
isopathic at least? So if I could just see that slide again, Debbie, it's
Sure.
disappeared. And some of the other problems, flatulence, constipation, and undigested or offensive acidic stools. You'll see children where their parents say, if I don't clean them immediately, the stool is so acidic, so toxic, it just strips the skin off. The skin will blister or it'll redden and bleed, and that's if I just leave the feces in contact with the skin for 10 minutes. So these children have serious, some of them, not all of them, have serious digestive problems. There will be bloated tummies, abdominal pain in the child, gut dysbiosis, where if you do stool tests, you'll be finding overgrowths of yeast, viruses, bacteria that shouldn't be there, parasites. And then, of course, all of that eventually weakens the gut, and you go on and get leaky gut, which is the cause of a lot of the allergies.
Right. And adults are really dealing with this as well. This has become so commonplace. And let's remind people that with homeopathy, we're not just taking care of a disease. We're looking at the symptoms, that the individualized symptoms, and that's how we find the matching remedy. Okay, the next slide is immune system dysfunction.
So again, you've got the food intolerances causing problems. You've got the allergies, asthma, eczema, frequent ear infections and other infections, prolonged coughs and colds, and increasingly autoimmune disorders going on.
I feel as if eczema is something that's been around for just so long as a first sign that there's something wrong with the immune system. I wonder if it's increased after they started with the Hep B vaccine that they give as soon as the baby is born. Those are kinds of things that I question. Just how wise are these? Oh, Paul, I was reading Paul.
They're certainly increasing, so something's...
Yeah. Yeah, Paul Offit said that you could give a child 10,000 vaccines. That's very logical, smart.
Not my child, thank you.
Makes sense. Well, if you have homeopathy so that the child could eventually metabolically clear these toxins from or as you said, we would all then be ill, right?
Yes, so we're talking about toxins. I know you and I had a brief discussion yesterday and we were talking about this area. How does homeopathy work and help? And we were discussing that many people, especially in the biomedical circles, because increasingly people are saying, there's a genetic base to this, it's a genetic problem. And of course, the response to that is how can you have a genetic epidemic in the space of one generation? But also, even if some of these children are obviously susceptible to injury from vaccines or toxins or whatever else is going on, and it's like the people say, well, it's like there's a loaded gun. inside there. The gun's fine as long as nothing comes along and pulls the trigger. It's these toxins or external influences that pull the trigger of the loaded gun. And we're talking about, it's actually homeopathy, doesn't get rid of the toxins, doesn't stop the pulling of the trigger. Homeopathy actually goes in and gets rid of the gun so that that's not going to be there and predispose the child to problems.
Well, it would be wonderful if all of these symptoms that we're itemizing could disappear. And I think my husband's reaction was, I didn't know that autism covered all of these different organ systems. You know, that I think is the big surprise.
Yes, and not every child has all of those problems. Some will have more of the gastrointestinal problems, some will have more of the immune problems. It varies from the child. And that's why autism's been such a difficult thing to get a handle on, because it's the whole body's been impacted. It's a whole syndrome or a cluster of effects and symptoms. So it's been very hard to say exactly what autism is or isn't, except the child isn't able to socially integrate into society.
So that sounds a little bit like fibromyalgia. They just like put a basket of symptoms in and say, this, let's give it a new name. Okay, so did we do immune system dysfunctions? And then slide 6 is neurodevelopmental problems, which is the one that is telltale sign that a parent can't avoid realizing something is definitely out of the spectrum of normal when, let's say, they began to have a vocabulary and now they're regressing.
Exactly. And they can even fail to reach their milestones or reach them and then start to slip backwards again. They can have delayed cognitive development. So you can have children who are developmentally delayed or globally developmentally delayed, and they just can't absorb information. They can't use it. They can't transition properly with that information. And I've just missed the rest of the slide, Debbie. I've probably got ticks there.
Yes, this is slide number 6.
Yes, poor eye contact, which is a classic symptom of autism. Though once again, not all children diagnosed with autism have poor eye contact, but a significant percentage do. There can even be seizures, tics and stims, fine and gross motor delays. So a child will have trouble with pencil grip or holding a pencil, or can't ride a bicycle, or is unable to blow their nose for many years, well beyond what other children can do.
So the fine and the gross motor skills, their difficulty, and also delay in teething, walking, talking, those regular milestones that you put in the baby book.
Yes,
And-
especially talking now. Now teething, well, walking can be gross motor delay, but teething's a little bit different, and we actually use that as one of the symptoms to help identify the remedy that may help the other problems associated with autism. But teething of itself generally isn't delayed with autism, but walking and talking certainly can be.
So is it that teething may be delayed or is very difficult where the child is so out of, has such discomfort and pain that they're crying all the time?
And they're very sensitive to that pain, and so they'll overreact to it.
Right, okay. So
Some of them won't feel it at all, and this is where autism's such a confusing area. Some children are hypersensitive to pain, other children are hypo, that they can, fall under a bus, get up and walk away almost, and not be complaining of pain. So that's just as concerning to people or parents as the child who responds in an oversensitive manner to pain. But some children can fall down, hit their head, get a cut, and just look at it, not feel it.
Right, and you think that your kid, bravo to your child, but it's really something that's not correct, because you want your child to be able to feel pain in order to learn and know what is good and not good.
Yes.
Okay, we have a couple of questions in the chat regarding the vaccination and autism link, and I know that that would be a show in itself, but maybe you could do a quick answer.
Is there a link?
Is there a link?
Yes, I believe there is.
Yes.
Certainly from my own experience, what I saw happen to my own children when I gave them vaccines, I certainly believe, just from personal experience at least, apart from the research that is accumulating, that there is I don't think it's just vaccines. I think antibiotics have a huge role to play. So I think it's often a combination of vaccinations, antibiotics, and the antifebrile medication we'll be giving children at the time of vaccination, whether that be paracetamol or whatever's being used currently. But if you get a child, it seems to me what I frequently see in clinic and I observed in my own children, they have the vaccine, something happens to the immune system, suddenly they're getting all these coughs, colds, whatever's going on, the antibiotics come in, and as soon as you get that, you're likely to have a child with serious problems. As soon as you get that gut disrupted.
Exactly, yeah, because we're learning the the importance of the gut. What do we call it? Biosphere? I don't know what to call it now. I'm being affected up here by a delay.
Mm-hmm.
Biome. Okay. Slide number 7, neurodevelopmental problems. We have sensory processing disorders, what you just mentioned, the hyper and hyposensitivity to smell, touch, hearing, taste, and visual. And I know that there are children who sound or light, it just affects them so highly that they cannot be in the room with too much noise. Speech and language issues, receptive and expressive. That's your communication, I assume. And being able to actually read other people's faces and facial expressions and understand body language and all of that is involved, because we are more than just our words. We are so much more of our whole being as a clue to what we're saying. Yeah. Go ahead.
So you can see the problems. You can see the problems that these children suffer from. You'll have some children with all these problems. You'll have other children with just some of the problems. But what you end up with a child who is having huge difficulty integrating with the world as we know it. It's an unpredictable place for them. It's a frightening place. It's a place that creates anxiety because they can't adjust and cope with it the way a neurotypical child does. So you start to get the withdrawal, you start to get the meltdowns. If you could understand what it's like for these children just trying to cope, it's really quite horrible.
Okay, it makes me feel a little bit better when I see the meltdowns, to understand and be a little bit more compassionate that it's the child is having his or her own issues with the world, and it's not because there wasn't a good mom. That's not the reason. Okay, and then
sorry, Debbie, too, just commenting, that's where the skill of a good homeopath comes in, because those children having meltdowns, you've got to work out, okay, is that meltdown because they are having serious trouble trying to process what's going on around them? Or is it as we would treat a neurotypical child who's having a meltdown, a behavioural problem, a bad behaviour that's still part of their imbalance, but it's coming out of that and not the autism so much. So you get a different two layerings going on, things that are purely autism related and other symptoms that are purely child related that would be happening in any child but can still be treated by homeopathy.
Right, so now you have to really have a lot of wisdom to know the difference. So then we have of course it is a scary world when there's learning difficulties, dyslexia, and poor memory. The child who's sitting at the front of the room is able to see the board and process maybe a little bit better than the child who's totally lost and spaced out in the back.
Everything becomes so much harder.
Right, and not being able to be part of the group. Slide number 8, psychosocial problems. Anxious, aggressive, withdrawn, or zoned out behaviors, difficulty in making or maintaining friendships, struggle to cope with any change. So then you've got the OCD, inappropriate behaviors and obsessions, and the self-stimulating behaviors. So everybody's more familiar today with words like stims and isms. So where the children are flapping their arms and back and forth, or swinging on the swing, or doing something that is self-soothing.
Yes, tapping themselves, or examining fingers, patterns of light, sideways looking.
Yeah, I think I was one of these children.
No.
Yes.
And of course, children are affected to varying degrees. Some children, they just these problems are causing minor difficulties for them. Other children are profoundly affected.
Yes, so we want to emphasize that there is a range, a huge range of where a child will fall in to the spectrum, and how much it does affect their ability to integrate into society and in their family dynamics and the school, wherever, camp, or wherever they are. Slide number 9. There it is. That was my missing slide. It was just in the wrong place. Okay, we're going to skip that one. And we're going to go to the next one. Now you're going to give us some background about homeopathy.
Yes, now I've still got, on my display, I've still got slide 6, but I can certainly give you background on homeopathy.
Okay. What do you have?
I've got slide 6. So I'm still back at neurodevelopmental problems.
Oh, maybe you have, do we need her to refresh? Otherwise, I can tell you what it says.
Yeah.
Okay.
We can work both ways.
Okay. Oh, why use homeopathy? And you have 4 major points, probably somewhere on the next slide. It provides treatment as well as prevention. So I guess that means starting really early.
And with treatment, not only treatment of the symptoms, but if you also need protection from childhood diseases or some of the epidemic diseases circulating, homeopathy has, right from the beginning of its introduction, has always treated prophylactically or been used prophylactically against epidemic diseases. So there's some protection there for a child who has severe immune problems or where there's concern about giving another vaccine.
Okay. I'm going to be talking about HP, homeoprophylaxis, later on in at the end of the show, because there is going to be an international conference in Dallas, Texas, October 2 to 4, for those who are interested in that program of HP, homeoprophylaxis, I guess in lieu of vaccines or vaccine-damaged children. So do you need to refresh in the browser there with Daily Motion? Does she need to do that to see an update of slides?
I don't understand something. Are you seeing the slides in your browser or in Skype?
In Skype, and so it reached up to slide 6.
No,
What's
in
happening
Skype
there?
it's correct.
I'll shut Skype down and I'll bring it up again and see.
Are
if it
you
makes a
are you
difference.
don't shut Skype just like that. I mean,
No.
do you wait a second. That's right. It's not
working?
there it is. Hold it a second.
We need the one with the flower.
We thought that it kept on going and it did not.
Okay.
All right.
Well, I will talk while
There.
you repair.
Oh, there we are. I've got it
Okay,
now.
you're good to go. Okay.
Yeah, good to go. So,
Remedies are long-lasting, simple to use, and easy to take. Yes, they are. It's not like taking the cod liver oil I take every day. No, it's really, tell them, Amnon.
I take it every day.
Cod liver oil?
I used to when I was a kid.
I'm talking about homeopathy. It's easy to give to children. And I don't know whether you do water doses or pellets or pills, but it doesn't taste bad, and the instructions are fairly easy once you get
yes.
them.
Yes, I mainly use the water dosing.
Oh.
And where we've got there that's capable of rapid and widespread change is one of the most fabulous things about homeopathy. And I always get a little bit chuffed when parents come in and they go, wow. Now, I should say too, I'm talking about some of the wow experiences. With some children, progression with homeopathy is a little bit slower than those absolutely amazing cases we remember. But when parents come in and say, oh my goodness, I went home and within 20 minutes he was looking me in the eye and asking me questions. And that would probably happen in about 10% of the cases I treat. Parents would notice a difference that quickly. And that's the beauty of homeopathy. So where you're thinking, gee, we've got to restore some sort of metabolic process to get that response from a child, I'm not quite sure what's going on, because to get that happening within the 20 minutes is quite remarkable. You can't imagine everything being repaired and reconfigured and hormones secreting properly and so on to get a response that quickly, but that's what can happen. And so parents who have been down the biomedical path, you may know you're waiting weeks to months to try and get improvement with that. Diet often brings more rapid improvement, because if you start to withhold if there are food intolerances or sensitivities there and you're able to withhold those foods, often you'll start to see a greater clarity of thinking if the child's being affected by them within 1 or 2 days. But I've never seen anything give the rapidity of change that homeopathy can. It's like magic.
It's a dramatic, rapid, quick change that you cannot overlook at all. And that's why at the beginning of the show in my prayer, I was saying that is super rational. It is not rational, logical thinking, but it's beyond that when we talk about the creative force and homeopathy. On the why use homeopathy, also we have the versatility of homeopathic remedies, how it safely treats injuries, and it's used for acute emergency situations and chronic problems, mental, emotional, or physical.
Now, this is where parents can put it to great use in the home, especially for acute problems. So if you're aware that your child has gut dysbiosis, and the last thing you want to do with another infection is give another antibiotic and either continue or worsen that problem, if you've got a working knowledge of homeopathy, you can quickly turn to a remedy to help with that cold or that tummy upset or that bruise or whatever it is you're trying to treat that you would normally use another medicine for.
And on the next slide, we have provides treatment as well as prevention. We did that. Has an excellent safety profile. It's non-toxic. So it's not like your cumulative effect of adding more toxins to the system or changing the gut biome or affecting the bacteria overgrowth in a toxic way. The rest of them, do you want to read them?
Yes, avoids or reduces the need for medications with unwanted or dangerous side effects, and we mentioned that briefly a moment ago. Doesn't work against the body by masking or suppressing its symptoms, which is really important, because while you get short-term relief, you're not actually correcting the underlying problem, and over a period of time you're actually worsening that underlying imbalance by constantly suppressing symptoms. Instead, it works with the body by stimulating and strengthening its ability to self-heal. So again, you're moving the child or the adult to a much healthier state to cope with other stresses in its life or their lives. And it's cost effective. Simple acutes can be treated in the home. And while it does cost to see a homeopathic practitioner, the appointments are usually spaced a month apart. Remedies are inexpensive, and over the period compared to other therapies and other medications or biomedical interventions that are used with autism, it is hugely inexpensive. It's significantly less expensive, much less expensive.
And the goal of constitutional treatment is full health rather than disease management. It works in a comprehensive way that few other approaches can possibly do. Okay, let's move on to the areas of improvement, and we're going to look at observing physical, emotional, mental changes prior to and post treatment. So prior to homeopathic treatment and then after. Slide 14. Go ahead.
Yes, we've got some of those problems that we spoke about earlier when we listed all of the areas or symptoms that can be experienced with autism. So that's what a child coming into homeopathy can be experiencing. On the other side, doing through the course of treatment is the parents should be seeing normalisation of developmental milestones such as a teething, walking, speech. improve sensory integration, so they're no longer sensitive to the noise or the light or touch of clothing, increase in the receptive and expressive language, improve confidence, focus and awareness. So all of those things should be improving.
Next slide, 15. Then you're also going to see the improved eye contact and social interaction, reduced anxiety, which is going to be wonderful for everybody in the family, reduced aggression and other unwanted behavioral issues, which is a major problem, reduced restlessness and distractibility, increase in cognitive function, so they do better at school, and better memory and ability to learn.
Mm-hmm.
Okay.
And the interesting thing, looking at those symptoms, that's a broad range of improvements we're expecting to see, and usually just with the one homeopathic remedy, with a remedy that will trigger that self-healing response. And in doing that, we get broad changes, whereas to manage some of those problems conventionally, you'd be needing different medicines. You'd need a medicine for this, you'd need a medicine for that, and some of those things couldn't be treated conventionally at all. Better memory and ability to learn. There's no medicine for that.
People want it. People want that memory pill. Okay, in slide 16, reduction in allergies and food intolerances, which makes it easier to prepare your meals. Improved immune function, better sleep patterns, digestive problems resolved, and elimination of toxins and heavy metals.
Mm-hmm.
And does this mean that we still need to clean up our home environment as much as possible?
Absolutely, because while we can move ourselves and our children to a healthier state where we're better able to cope with those toxins, it's really just poisons. And it's the same with any situation, that if somebody's being poisoned for long enough and strongly enough, eventually we're all going to become sick. So we need to clean up our environment and try and reduce our exposures to some of the things that are causing us problems.
And there are many studies that were done, I think in India or other places around the world, where the water had some arsenic in it. And it was very poisonous to the population, and they were having lots of symptoms. And the homeopathic remedy arsenicum was actually cleared these people of their illness while they needed to clean up the water too. Yeah.
Yes, and that's
Okay.
one thing the study noted, that the treatment with arsenicum or with arsenic in homeopathic potencies was only a short-term option. That yes, eventually what was preferable was to remove the exposure. And that's pretty much the same with homeopathy across the board, that if there's constant poisoning, eventually our system will weaken under it and will succumb. We do need to remove the exposure.
Slide number 17. This is what you were just telling us about those 10% of
Yes.
your patients.
Yep. And certainly with the way I treat children, what I'm telling parents, that if they're not noticing some sort of positive change within 3 doses, which is usually 1 to 3 weeks after treatment begins, I've got the remedy wrong, we're going to stop and we're going to move to a different one. So certainly by 3 doses of a remedy, and this is the other thing that practitioners aren't surprised, but parents are surprised about, that the remedies often only need to be taken infrequently, once or twice, maybe 3 times a week, sometimes daily for some children. It varies from child to child, but a daily dose is not necessary with homeopathy and is often counterproductive. So what I
Good
tell my parents,
information.
if we're not seeing changes by 3 doses, I've got the remedy wrong. That's how quickly homeopathy should be working on these children.
And through the 20 years of experience, you have that confidence level to know that it should be working by that number of doses
Yes.
and that amount of time that has lapsed. Slide 18. Improvements are cumulative. If the remedy is correct, the child should obviously be getting better from week to week and month to month. And I have spoken to parents who've said the first month they were getting a little improvement, they were getting better, but then there was like this backslide where they, so can you explain that a little bit, or does that have to be individualized?
It can happen for a number of reasons. It depends on possibly the strength or the potency of the remedy needs to be, And I'm conscious when I talk to parents about potencies that they often think it's a stronger, if we go up in potency, we're getting a stronger dose, or my child's needing stronger remedy. In actual fact, it's just a slight change of the state of the remedy. And we can either go up in potency or down in potency, as long as it's to a new potency that the child's body hasn't adjusted to or become used to. So it might just need a simple change in potency. It may be the case that the remedy was only a partial match to begin with. And this is where the skill of the practitioner comes in, because at that point, in the first follow-up or subsequent follow-ups, the practitioner should be looking at what's new, what's the same, what's improved, and is there anything that's worse? And looking at the difference in intensity and duration of symptoms. So by examining everything across that grid, we can work out, okay, this remedy improved these symptoms, these ones have relapsed, and a couple of new symptoms have popped up here, minor symptoms have popped up here. And that information guides the practitioner as to which remedy to go to next, or whether it's just a change of potency that's needed. Or another thing that can happen, which confuses parents sometimes, because we tend to think of homeopathy like a herbal medicine or a supplement, that we need to take it every day, and if my child was initially getting better and is now getting worse, I should take it more often. If I give more doses, maybe we'll get that improvement back again. When sometimes it's actually the regular doses or the increasing doses that are causing the relapse, and the remedy actually needs to be taken less often. Instead of twice a week, the remedy may only be needed once a week. So if a child was initially improving, Debbie, on the remedy and then started to fail to improve or relapse, I'd look at what the symptoms were showing me. Possibly the first thing I would be choosing is to say to that parent, I want you to miss 1 or 2 doses of the remedy, because if we've been dosing for what that child needs at the moment, we will see on purely stopping the remedy, that improvement will start again. We've triggered that self-healing response. We want to let the body continue with it, and then only dose again when the body tires and isn't able to do it anymore or needs a reminder of what to do. That's the best time to redose. So very complicated. It can be either a change of potency that's needed, a new remedy, or just that the child's being overdosed with the remedy and we need to give it less often.
It sounds like a lesson in the Organon of Medicine by Dr. Samuel Hahnemann, because he explains all of
exactly.
that right in there.
In very long sentences, longer than mine.
In regard to autism and Asperger's, while some children lose their diagnosis within weeks to months, others make slow but steady gains over many years. So it is, each child is individual, and if you do see your neighbor who is getting immediate results of communication skills and everything else, but your child is much slower to gain those skills, it's not the skill of the homeopath or the remedy. It's just the way the child needs to come back into life, I assume.
Yes, and I can tell you a personal story there, and it's concerning Amy Lansky, who wrote The Impossible Cure with her son Max. And I'm sure Amy won't mind me mentioning her or her book, but way back when my son was diagnosed and autism was very poorly understood or known or recognised, and I was on a homeopathic forum, I was still a student myself, and Amy came on talking about her son. She'd been to see a homeopath with her son, and he was getting amazing results with this remedy called carcinosin, and was jumping ahead in leaps and bounds, and all her son was needing was occasional changes in potency of that remedy. And I was sitting on that forum looking at my son, where yes, we were getting him, but I was a student homeopath trying to treat him because other homeopaths hadn't seen autism and weren't as aware of his symptoms as I was. And while my son had made improvements, we'd had to change remedies. We weren't getting the smooth run that Amy's Max had. So that's very much a case in point. My son took longer to improve than my friend's Amy's did, but significantly improved with homeopathy. And that's one child will need just the one remedy right the way through in a change of potencies. Other children, like my son, will need changes of remedies and changes of potencies, and that's where you really need the management of a well-trained homeopath.
I agree. But we have a note that all children should see some improvement, even if it's small gains or greater gains. The amount of improvement and the length of the This is slide 19. The length of time needed for full treatment depends on, as you were saying, severity of symptoms, degree of irreversible damage. That would probably be pathological changes, physical changes. Closeness, I mean, if there was a birthing where it was traumatic birth and there was actual damage. Closeness of the match between the remedy and the person's symptoms, and the skill and experience of the prescriber in choosing remedies and managing the changing symptoms as treatment progresses. So this tells us that you need to have a close relationship with the practitioner, that they are kept aware of what is happening with the child on a frequent basis, so that if there's any changes, to be told.
Exactly.
Okay, let's go ahead with a polycrest and tell us about that.
Now, our polycrest remedies are the remedies that are used again and again and again for a wide range of symptoms. And Natrum muriaticum, or NatMur, or NatM, is prepared from just common table salt, and it's our biggest polycrest. It treats skin disorders, depression, types of mental health problems, herpes. It treats a whole range of problems, as long as the symptom pattern that the person is experiencing corresponds to NatMur. So let's have a look at it for children with autism, because it is a common autism remedy as well.
Right.
They tend to be very serious, reserved, and often well-behaved children, so they're very quiet. You won't have them talking a lot, and they don't want to interact. They're sensitive and easily hurt though, but they'll hide it. So when they're hurt or upset, or being made fun of or laughed at, even if the family's just laughing around them, will often perceive that they're that the laughter's about them. Rather than getting upset and crying, they tend to go quieter and quieter and withdraw. They're excessively upset by reprimands from a parent, so if a parent has to discipline them or speak sharply about something, there can be an overreaction then, all proportion to what the parent was saying, or yes, they're just very, very sensitive to being corrected by parents.
The next slide. There's a strong attachment to the mother figure or one other important person. They would draw into silent grief, is what you were just explaining, if the mother does not respond as they would like, and they feel grief and loss deeply. They may raise the death of relatives or pets for years following. Well, I guess that means that they talk about death or they think about death, and they're very much affected by the loss of a loved one, an animal, or a friend.
So remember, with these children, they're not going to be talking excessively about it, because this remedy is all about withdrawal and internalization.
Okay.
But in terms of an animal, it might be 12 months later, the child might raise, Scobie's gone, in talking about a budgie that's died, or where's Scobie? You might just get constant references to a pet or a grandparent that has disappeared. But they won't be crying about it. They won't be wanting to talk about it endlessly. It'll just obviously be on their mind. These children too, if they're being bothered by something and the parents trying to find out why, what went wrong, why they're unhappy, trying to push them or get information out of them is literally like pulling teeth, because the more you inquire, the more you ask, or the more you try and sort out the problem, the more they withdraw and the more they shut down. And they go into this very sad state where they look sad and as if they're in grief, but it's not a visible grief, it's just a hidden away from the world grief.
Do they say, leave me alone, a lot?
They can do if they're pushed, but especially in children with autism, they'll just tend to go quieter and quieter and remove themselves from you. If you try and cuddle them and hug, they'll pull away from you. They won't come for spontaneous cuddles. Now, as I said, there's usually one person they are quite closely attached to, so you may see that they are quite affectionate with the mother. But when you ask a little bit more closely, you'll say to the mum, is he or she affectionate? And they'll say yes. And then you've got to unpack and find out if this is the remedy that's needed. You'll have to ask, do they come for spontaneous cuddles? Will they cuddle you spontaneously? Or do you always have to give them the cuddles and they accept them or put up with them? And usually you'll hear it's the second thing, that yes, they're happy to be held or cuddled by one person, but they don't cuddle back. They're the cuddlee rather than the cuddler.
That's a good way to put it.
Yes,
And
this is one
and in
remedy.
a group, you have in a broader way that they're more antisocial, and they ignore
Yes.
people, avoid eye contact, which is part of that ASD syndrome, and they want to be alone and feel better when they are alone. So they like their space.
Mm. And when they go to childcare centres or to school, that's what the carers or the teachers will report, that they sit off by themselves and do their own thing. If they try and move that child into a group of children, they may stay there, but the other children eventually go off and do something else and they continue to sit there. They won't follow the children. Or if they're pushed into a group, they will play on the periphery and eventually remove themselves from the group. So it's a very solitary remedy. And they don't seem to care that they're alone. They want to be alone. They're not upset when other children aren't playing with them. They want to be alone.
Slide 22. They avoid conversation and interaction and withdraw when questioned, which you mentioned. Tolerate or avoid hugs and cuddles. They don't actively seek them. They dislike consolation, which would be one of the rubrics in the homeopathic repertory of desires or averse to consolation, or sympathy when hurt or upset. It may even anger them. So do they get angry easily?
They can do if they're being pushed enough. They'll withdraw and go quiet first. But if the parent is, or if they're working with a therapist who keeps pushing and pushing, they can become quite aggressive and quite upset about it.
Fran, I put up a little video on Facebook last week of a dog trainer that had an entire group of dogs in beyond the gate. And then she stood on the other side of the gate and would call each dog's name. You know, Rufus, Terry, Samantha. And as she would call each name, the dog by that name would get up and go. There was one dog that went all the way in the back in the corner and turned around and showed their backside. That must have been
Just the one?
that must have been a nature mirror. But one of the rubrics I found in the repertory was easily disciplined is nature mirianicum. So
yes, they tend to appear to be compliant, obedient children, but they won't. Yes, it's the interaction that you will notice. They don't want to interact. They withdraw. They don't want to talk.
they want to be good and they want to behave. Okay, the next slide is 23. They're slow or reluctant to talk, but usually able to speak more words than they will.
And this is another thing in consultation too, is that parents will come in and say, my child's nonverbal or my child's not talking. So you've got to unpick in a consult, okay, is this child truly nonverbal or are they just not wanting to talk? So you've got to ask, as a practitioner, you've got to ask, okay, can your child, do you get the feeling that your child can actually say more than they will? And or are they trying to talk and just can't vocalise, can't form the words? Do you see them trying and not being able to talk, or do they just refuse to talk and occasionally surprise you with what they know? And for a NAPMER child, it will be the second, that the parent will say, yes, every so often they'll come out with this word and we had no idea that they knew that. And when we try and get them to repeat it or say it again, they just point blank refuse. They won't do it. And that's very typical for NAPMER child.
Very good. I'm just thinking about how when my cousins were little, and you know how the child always mispronounces words, and you think it's so adorable and cute, and the older cousins will ask the child, say, I don't know, baloney or whatever it is, and they say it
Yes.
and it sounds really blah, and so then when you ask them, they won't say it again.
From embarrassment.
Or they
Whereas
love
the
to say it.
Yeah, the NAPMER child will often say it perfectly and refuse to say it again just because they don't want to.
They're stubborn. Self-conscious about urinating in the presence of others. This can also be a number of other remedies. May
Yes,
have a... Go ahead.
most of us don't like doing that, but it's particularly prevalent in NAPMER.
Right, that's
They'll
the
go off
embarrassment.
and they'll go off and do things secretly. where they're not drawing attention to themselves.
Whoever likes to go in school in the stall? Nobody.
Yes, nobody.
May, and they take the doors off too, may have a
Oh,
strong like or dislike of the seaside, which is very interesting, and sleeps on the left side. So these are modalities in homeopathy that we look at, likes and dislikes, and ameliorates or make aggravations. And so there are other remedies that have this also.
yes.
Um,
NAPMER is not the only one.
Right. And then on slide 24, we have all of those physical symptoms, outward symptoms that we can see, or the child has constipation, dry skin, dry and cracked lips, especially in the center of the lower lip or the corners of the mouth, and the herpes type of cold sores, oral herpes. On the next slide, which is slide 25, they have facial and hair and oily hair during the teen years, during puberty.
Yes.
Headaches or migraine worsened by sun exposure. So these are people who might be wearing sunglasses quite a bit. Hay fever and colds with sneezing and discharge like egg white. So it's kind of weird if you go to a homeopath and you say, "Oh, you're blowing your nose. What is it like? what is the discharge?" And this is another bit of information that's helpful. Watery eyes especially occurs in open air or wind. Doesn't that happen to everyone?
No, never happens to me.
Really?
No.
Okay, well, you're not a nature mirror. Asthma in the evening. Okay, so I guess there's different times of day or night when asthma could happen. And we said sleeps on the left side as before. Slide number, do you want to say more?
Yes, so a child isn't necessarily going to have all of those symptoms, but those are common physical symptoms that children needing NAPMER may present with.
Okay, so we need to remember not to cancel out a remedy just because the child does not have a particular symptom.
Exactly, but if the physical symptoms the child does have is covered by NAPMER, and NAPMER will cover more symptoms than I've listed on that slide, we've just presented some of the more common ones, but if the child's symptom is covered by NAPMER, it will work, but the child doesn't have to have all the NAPMER symptoms.
Slide 26. These are the foods.
Their food intolerances tend to be around milk and wheat. They like pepper, fish, salt and salty food, and they don't like fat or slimy food. So chicken fat, that really slimy fat, or things such as custards or even yogurts. If it's too thick and slimy, they tend to dislike it. And they can like chicken, but by the same token, they might have a strong dislike for it.
I think one of the rubrics is either desires and loves bread or averse to bread. So it can go either way.
Yes.
Right.
And that's why what we said with these slides, we've just got some of the more common symptoms. If a parent is listening and thinks, oh, my child matches this and this, but it also has this and this symptom that hasn't been discussed, don't think NAPMER isn't or couldn't be the remedy. It could possibly be. That's where you need to examine the NAPMER symptom picture better, or go to a homeopath who can do it for you.
Who can understand the basic running theme behind that child's disorder. Slide number 27. What happens when they get the remedy? You're going to see some improvement in these areas.
They're going to be less serious. They're going to want to interact and talk with others more. And that would be a very common thing. If I wasn't seeing that happening with children or hearing that happening within 2-3 doses of the remedy, I know that that child's not a NAPMER child. I need to re-prescribe. One of the very first things that parents will report is that they start to spend time with the family. They're more interested in being with the family. They start to talk more with the family. When strangers come to the house, they're not leaving the room immediately. They're staying nearby and may sometimes even talk to the strangers, which is a huge breakthrough for these children, because up until then, the more people have tried to interact or with strangers, they just shut down. So increased enjoyment in the company of others and better eye contact and more conversational. All of those things we've discussed.
Slide 28. More likely to give and receive those physical cuddles of hugs of affection. They stop overreacting to being comforted or consoled. So I can just picture that. Less sensitive and more resilient about emotional hurt. So it doesn't just go deep into them. They're just not affected by it as much.
Yes.
And they're able to let go and move on from grief. And it is our number one grief remedy in homeopathy besides Ignatia.
And with grief too, it doesn't have to just be about the death of somebody or a pet. It can be grief about a move to a new house, and homesickness is a form of grief, or disappointment, not getting something or losing something you loved is a form of grief. So that's what we're looking at in the NatMer picture as well.
Okay, and slide number 29. The skin dryness or oiliness comes into balance. The physical complaints improve and resistance to infections increases. And they feel just more happy in general about everything, which would be just
it's a wonderful
delightful.
remedy.
Phosphorus is the second polycrest. We're going to pick up the pace. There's two types of phosphorus. We have the open, bright, excitable, bubbly, warm, caring, friendly, curious. They want company. They're not like the nature mirror. They want company.
And this has been a very deceptive remedy for homeopaths, because when we think of people needing phosphorus, we're very familiar with the type 1, but in autism there's the type 2, and these are often missed. When phosphorus is the remedy they really need, homeopaths may be going off and prescribing other remedies, not needing that the polar side is present too. The slow, apathetic, dull-minded, indifferent, spacey, zoned out, poor focus and concentration. And you'll see a lot of children with autism like that who do very well on phosphorus.
Wonderful. And I'm thinking how we've been told phosphorus is a person who doesn't recognize their own boundaries, and they're just out. It's almost like nature mirror closes into that little shell and it withdraws and creates a huge boundary, and then the phosphorus is just so out there in my sky that you're spacey, that you don't know the difference between the other person's hurt and your hurt.
Yes, so NatMer internalizes, phosphorus tends to space out, or with autism you can still, there are lots of autistic children who are bright and excitable and bubbly. People think our typical impression of autism is that they're all shut down and internalized like NatMer, but talk to parents who are familiar with children with autism, and that's not so. Some of them are very affectionate and some of them are quite interactive and talkative.
And don't ever shut up. But I could even throw a wrench in the whole thing and say that there's a remedy called Nat Foss.
Yes, combination of the two.
A combination, and that will throw you off base. So let's not do that and go to the next slide, which is about the different types. They're sensitive to odors, textures, and foods. Anxious is a key thing, especially when they're alone. So they don't like to be alone. No. Anxiety relieved by being with company. I think of arsenicum as that also. And numerous fears, being alone, death, the darkness, thunderstorms is a big one, and insects.
So both types will tend to have symptoms in this area, or these sorts of symptoms.
I usually think of horses that get spooked from thunderstorms. It's phosphorus.
Yes.
Slide number 32, physical symptoms and appearance. So this is good for your respiratory system.
Yes, and they tend to have, so these children can get pneumonia easily, especially as infants, and colds tend to go down to the chest, so they get very chesty infections rather than them all staying up in the upper area. Can bleed or bruise easily. Parents will often say that, he gets bruises all over his legs, and I can't remember him knocking the leg. They'll report that there's, or nosebleeds, frequent nosebleeds.
And there are many remedies that have frequent nosebleeds, so this isn't the only one.
No.
the next slide says that concerning the allergies and food intolerances, they particularly like salty foods, spicy flavors, cold food and drinks, especially ice cream and sweets and chocolate. This is like everybody. And they either crave or dislike fish. That's good to know. They're thirsty for cold water, and they have an intolerance of milk. Is it that they don't like milk, or they just don't do well with it?
They don't do well with it, and some children very early in the recognize that they feel unwell after milk, so they'll start to develop an aversion to it as well. So they can have an aversion or be aggravated, but still desiring it.
Mm-hmm. Does that include cheese?
I'll have to check. I'm not sure. I don't
Mm-hmm.
think phosphorus has a big problem with cheese. I'd
Okay,
have to go away and check on that.
that's good. Okay, and then we have a little picture of this adorable young man. The phosphorus child, usually you think of them as thin and tall as they go through puberty, delicate features, fine skin, porcelain, clear skin with long lashes is the tubercular miasm, and they have a rapid growth.
Yes,
So,
and this little boy, I chose that image because that's very much what one of the more social phosphorus children would look like in autism. They're friendly. They will look at you. They'll want to interact.
mm-hmm. Will they get in you right up in
Not.
your face?
Hmm.
I have a grandchild who would do that. Okay.
Ah.
What's
I'll just make a mention too with phosphorus. It's one of our big allergy remedies. And so the reason why it can do so well for children with autism, if there's a lot of food intolerances going on and leaky gut and so on, the child's has been sensitized to the not fully digested food particles, they tend to zone out and become spacey as it travels through to the brain. So that causes that spacey zoned out effect. And if you treat them with the phosphorus, and the gut healing starts as a result. So remember, homeopathy is working quite deeply and healing's occurring at a deep level that's causing these surface symptoms. That's where you'll get the improvement in that zoned out child that's usually coming from the food intolerances and leaky gut.
I appreciate that because I have been thinking a lot about the interaction between how the body and the gut affect the brain, the cloudiness, concentration, thinking, but then also how what we think affects how we feel and how our body works. So it's a two-way street, but whatever we can do to help this, the link is really good. What to expect, the confusion and brain fog clears, the child's able to focus and respond appropriately, the anxiety settles down and they are less fearful. They're not so dependent on company and can spend time by themselves. That would be wonderful.
Yes, for many
Yes.
mothers.
So they're not clinging to your legs. Slide 36, more confident and capable, sensitivity to odors and the feel of clothing settles. Ooh, that's a big one. Reduced tendency to bleed or bruise, more resilient to colds and chest infections, and reduced allergies and food intolerances. Fabulous. Things to know. What do we need to know, Fran?
Oh, coming into appointments. So if you're having an appointment with a homeopath the first time, most people are really surprised at the sort of questions we ask. Anybody coming to see me, I warn them to begin with that I'm going to be asking a lot of strange and unusual questions that their regular doctor's not the slightest bit interested in because it doesn't help with their prescribing. But these unusual questions are very important for homeopathic prescribing. So the consultations are normally lengthy. They're normally an hour to 2 hours in length, depending on the age of the child. We need to know everything. We need to know everything from all of their physical symptoms, tendencies in the past. We need to know birthing history, pregnancy history of the mother. We need to know food likes, dislikes, sleep how the child reacts to things in the environment, certain stimuli, basic temperament and personality, because even with autism, we tend to think autistic children are all come out of the one mould. They don't. They're still children with the fundamental temperaments and personalities underneath, with the autism as an overlay sitting on the top affecting everything. So fears and anxieties, family medical history is also important for MISMs. All of that we need.
Okay. So make sure that you provide accurate and complete information. And that's why I'm going to emphasize, I always emphasize throughout all of shows, keep a journal.
Yes.
And your homeopath will guide you through this process by asking all the questions that Fran suggested and encourage you to tell your child's story as fully as possible. Remember that each practitioner may have a slightly different approach in the way they collect the information, but everything will be covered over time. And in slide number 39, you want to be able to give the immediate problems, and then so that we can take care of what's happening at this time in history, the present, and then the other symptoms will probably unfold as you go back in time. Okay, so I think that you covered that. Slide number 40. This is a great way to remind yourself of the answers, these different things. When was the last time you had a doctor visit or other health care practitioner visit? That means that there was a point in time when something was going on in your child's life. When was the last time you had to purchase some medication, whether it was orthodox or complementary medicine? That's another historical fact that goes into your journal. Was there a hospitalization or a surgery at some point? Of course, you mentioned the pregnancy and delivery, if that was unusual in any way. So you can jog your memory and maybe even ask your partner or your friends if they remember anything. Let's go to slide 41. That's talking about the relevant pathology tests or diagnostic investigations. So that's an important part of their history for the homeopath as well. And anything else about that particular bit of information?
No, I think that's explanatory.
Okay, 42. The strength of their, okay, so this is going back more to those unusual questions. I think you went through most of these, including sleep, repetitive dreams, if a child has nightmares, if they wake up in the middle of the night, if they have to come into your room and sleep with you. What are the seasons or the weathers that maybe every single autumn or fall they get sick with that allergy or cold again. It's always during Halloween. Mm-hmm. The reaction to music and to their pets, that's really good too to note. We have slide 43, sleep patterns, position that they sleep. Do they sleep on their tummy? Do they sleep on a side, which was mentioned about the left side for Nat Muir? Different, okay, I think this is a repeat of the same thing. Mm-hmm. And that is also sort of like going to the seaside, or do you like the mountains better? Where would you like to go for vacation? This slide is all about the pregnancy and early development. Slide 44. You want me to run through it? I'm speeding through this.
Yes.
Okay.
Yes.
So
I was going to let you take through it.
Okay, take a breather, take a rest. This is it's important to note the parents, probably the father and the mother, what was going on in their life, if there was any extreme stress that might have affected the development of the baby in utero. I mean, if you fall down a stairs, you might have an arnica going on there. Vaccines, were they ever given? And they're telling pregnant women now to take a vaccine. That blows my mind, but who's thinking about it? The time is it took for the infant to reach milestones. We did all of that. Okay. Slide 45. Excesses in personality traits and behaviors are also symptoms of ill health. Practicing, okay, these are really cool things. Practicing how to save and spend money wisely is a good thing, yes. But if spending money creates anxiety, like you're constantly counting your money, or you're hoarding, or doing something weird, that's a problem. Or if you're hoarding at all, that's a problem. In the same way, there's nothing wrong with being organized and neat. Yay for that. But if these good traits are replaced by OCD, obsessive tidiness, or controlling behaviors, you know, the people who have to go to the wall and turn the light switch on up and down 10 times before they go in and out of the room, your child is no longer operating from a place of health. Or if you leave the house and you're constantly thinking, oh my gosh, I left the oven on. I didn't lock the door. Okay. One of the amazing things about homeopathy is that the right remedy stabilizes moods and behaviors just as easily as physical problems and symptoms. Thank God.
Yes. And I often say to people that one of the beautiful things about homeopathy is it puts us in charge of our behaviours and emotions rather than our emotions and behaviours controlling us. And for a lot of children and adults, that's the position they're in. Their behaviours and their emotions control them. They no longer can control, you know, the
Perfect.
emotions, and that's the difference.
Absolutely. We should be using our mind and our intellect to make decisions about how we respond in all situations. If it's bad, walk away.
Yes.
Don't get involved in a fight. Kavitha looked it up and she says that phosphorus likes and desires cheese.
Thank you.
Thank you, Kavitha. Changes in behavior during sickness. Now, this is an important point. If your child is normally happy and easygoing, but has become irritable, fussy, or emotional during an illness, this is something to report to your homeopath because it may lead the homeopath onto what's happening with the remedy. Slide 48. Here we have a major symptom of ASD. Fears, phobias, and range of other things should not be thought of as a normal way of life. It's not normal for your child to be constantly afraid of monsters in the dark at night and need to be with somebody every single night. Maybe they shouldn't be watching all of those scary films. They too are symptoms of underlying imbalance and point to a needed remedy. These behaviors soften and resolve with treatment. Or if they are treated, would the child just say, well, I guess, would they be affected by all of those bad, scary things out there?
No, they become much more resilient in that area. Parents will tell me that they're happy to have the light switched off at night, or they stop waking up in the middle of the night and coming into the parents' bed because they're frightened, or they go down to the bathroom or the toilet themselves because they're able to cope with the dark corridor now. That's what should be being seen.
Okay, 50. Oh, it's 49. This. Oh, 49? I think I did that. 49, sorry. This includes, and there's a whole list of fears: darkness, animals, heights, thunderstorms. If some children who are constantly worried something is happening to their family member, blood, snakes, spiders, crossing bridges, ghosts, and monsters. Too scary for me. Your homeopath should also ask, the news is too scary for me. Your homeopath should also ask about the family medical history, so you do want to have a background. If family members have had cancer, heart disease, lung problems, strokes, mental disorders, this can help to narrow down the remedies. They will then use all the collected information to build a complete picture of your child's health. The remedy that best matches this symptom totality is able to work deeply and stimulate widespread changes. I think the other day I had a query on Facebook from somebody about floaters in their eyes, and they wanted to know, what is the remedy? Give me the remedy for floaters in their eyes. And I said, don't worry about that minor thing. Go and look at the totality. See what everything is happening with you, and you'll come to a remedy that includes it. Slide 52. Your homeopath will check for things that may have caused your child's health problem, which are acting as a barrier to healing. So there are blocks if you're constantly in a moldy home. If the brother or sister is always beaten up on the one, that's a problem. That it's
Yes, the brother or the sister. It's a treatment then.
And you have an example here. A child with respiratory problem or allergy will struggle to improve in a moldy house. Likewise, constant exposure to harsh or irritating chemicals will not only cause dermatitis, but will interfere with its healing, even though the correct remedy may be prescribed. So maybe your clothing detergent is irritating. Finally, your homeopath will refer you and your child to your doctor for pathology or diagnostic tests should his or her symptoms indicate the possibility of more serious disorder. We had a question back from Tatiana wanting to know more about Natrum Phos.
That's another show.
That's another show, Tatiana. Tune in next time. We are going to do a quick summary. We went really long on today's program, but we just had a lot of information to present to you. I do believe that we live in challenging times with many stresses to our emotional, mental, and physical well-being. Families are seeking a gentle, non-toxic approach to healing and rebalancing lives. I don't have the actual dollar figures, but I know it's very high for people who are doing out-of-pocket just for their own alternative integrative care and supplements and vitamins. They're not thinking that it's not working for them to just only go to the conventional physician and get a drug for your depression. I also wanted to give a shout out to Dr. Samuel Hahnemann, who was born 260 years ago in Germany. He was the founder of homeopathy. He discovered the brilliance of it and wrote the Organon of Medicine, if anybody wants to read it. Millions of people around the world have found these remedies beneficial for acute and chronic conditions and are even needed more today than ever before. Today's homeopaths have been using and expanding their knowledge about autism spectrum disorder, ASD, and we're going to do part 2 of this program on April 27th with Fran.
Yes, we'll cover a lot more of the practitioner side of things too, things practitioners need to be aware of along with parents.
Right. I hope it's been okay. I've done a lot of the talking, but I think you've really filled in the depth of understanding for us. On a couple of other issues that are going on, I have been plugging Laurel Chiton. I had her on a show a couple of weeks ago for the campaign Just One Drop. She is an international award-winning PBS film producer who's been working 6 whole years traveling around the world, having film clips of homeopaths and how there's scientists, the pharmacies, a look inside the pharmacies and seeing how homeopathy is actually manufactured. And the campaign has tried to raise $80,000. I think that they're just coming to fulfill that dream. But she wrote to me today saying that because of the number of issues that are going on today in the legal fields, that homeopathy is constantly changing and it's on the front lines. So she wants to do 2 more trips out and do more filming to show us what's happening out there and show us the science. So please go to Just One Drop on... There's a link on Homeopathy World Community with the link to, what is it? I'm not remembering the name of the fundraising. Indiegogo, yay! Indiegogo, Just One Drop, and donate a little bit something. Maybe if you give $100, you'll get the pre-film. Then we have reminder. Contribute to the online book being created by our dear Fran, and you can contact her. Let me see. I thought I had, my things didn't save what they were supposed to. It was, what is it, Open Homeopathy?
Yeah, openhomeopathy.com. If they go there, /introduction, the introduction of the book is there already. So chapter 1 should be there next week, but currently the introduction is there. And I'll be putting a link to the survey so they can tell me what information they need to know, what should be in the book. And yeah.
It's going to be fabulous. So over time, you're going to be building the chapters of this book, and people will be able to read it throughout the developmental stages until it's finally published, and that may take some time. Mm-hmm. And you will answer the questions that people want to know about how you do this process.
Yes.
Slide 57. You have concerns about vaccinating your children, or they're going to make it mandatory to vaccinate all of us with a 60 boosters pretty soon. You want that? Okay. Check out October 2 through 4th in Dallas, Texas. There's going to be a homeopathic prophylaxis conference. It's hpworldwidechoice.com. Click to register. And Dr. Isaac Golden, who we've had on the show 2 or 3 times, will be there with many other great people involved with this issue with a lot of experience, plus Alan Phillips for your legal rights and vaccine exemptions. Okay, and slide 58. In June, we're going to begin a new series with Dr. Pawan Parikh of India, of Agra. And he's asking me what topics do we want to go over. And I think we're going to talk about cancer. We're going to talk about constipation. If there's any particular issue that you want to learn about, he has thousands of patients with a lot of experience in illustration of their cures with documented lab work and reports and everything else from the pathology. So you will see the brilliance of homeopathy. Do not forget, if you're on the website right now, nissancommunications.com, someplace on there's a click to Sufficiency, the vitamin drink with green tea and stevia. Is it below? Right below the video. There is also on Homeopathy World Community, they've upgraded the Complete Dynamics computer program for homeopaths. It's wonderful, it's easy to use, and it's complete. Thank you so much to Fran for taking out this her precious time to be here with us, and to Amnon for doing a nightly show and extending beyond. I think I'm going to let Fran wave.
Yes, thanks, Amnon. Very much
I want to get you back on there. It's just wonderful to see your lovely face and to get all this information. Oh, I love doing that with my granddaughter. I say, wave like a princess.
Or the queen, isn't the queen
the queen. So anyway, it was fabulous, and we will see you back April 27th. And in between, I'm also working out to get Tony Bark on. So look for that in an upcoming show, too. Thank you, everyone. Lots of love. Lots of healing, many blessings to everyone. Good night.
Bye.
You are tuned to the Nissan Communications Network. Our weekly lineup of call-in programs includes Computers 2K Now with Amnon Nissan, Health In with Debbie Bruck, Breaking Free with Marilyn Shannon, Lessons of Vietnam with NCBVI members, The Tanya Love Show, Your Healthy Pet with Gisela DiCarlo. And if you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it at www.nissancommunications.com. Sponsored by Atomos.com, makers of quality video recorders and converters for professionalaapparel.com, and DeltaForce.net,